once patients are optimized, how often do they have to come to your consultation or have their blood checked?
The first year, there's about 3 to 4 consultations, so there's a closer follow-up, and afterwards it's an average every 9 months. Ideal would be every 6 months, but 9 months is sort of compromise. When we have people coming from very far, they can only come once a year, and so then they come once a year in consultation. Of course, it's a little bit easier now because we have telemedicine, and so we can do on a distance. The problem is with telemedicine is that in their country, it's sometimes difficult to get the products. So they have to go at the pharmacies here nearby that can have almost all the products that are prescribed.
Mm-hmm. Okay, let's get back to something we talked before we started the recording, and that's the estradiol, the estrogen. Because I know there has been a whole debate everywhere on my channel as well between different experts. Do we have to block estrogen, yes or no? So can you elaborate on this a bit?
Well, when men have too much estradiol, they begin to have breast formation, a bigger prostate, and there seems to be a premature aging of the heart and the arteries. And but you need estrogen because when you give testosterone, most of the effects of testosterone come from a conversion of testosterone to estradiol in the brain, in the bones. So if you block estradiol too much, you will get thinner bones or empty bones, osteoporosis easier, and even the mind will not so be good. It could be more depression. So we need to do a right balance. Everything is the right balance. And what is the right balance? If you know something about laboratory tests, the estradiol has a reference range between, let's say, 10 and 50, or 15 and 40, depending the labs. But basically, if a man has 24 picograms per ml, he has the lowest mortality. If it's lower or higher, mortality starts increasing and disease too. Osteoporosis when it's too low, and heart failure and atherosclerosis if it's too high. So what we try is to get the right balance. And the first thing to do is not to give a blocker, is to stop drinking the things, the patient should stop drinking the things that increase the estradiol, and that is alcohol and caffeine.
Yeah, sure.
2 glasses of coffee per day, on average, 60% increase of estradiol. 1 glass of alcohol a day, 60% also on average increase of estradiol.
Mm-hmm. So first, you recommend those dietary changes as well next to the hormone treatment?
We always say to patients, look, if you don't improve your diet, you will respond much less to the treatment. So the first thing to do is to improve the diet, and maybe your hormone levels are already going to increase by 20-30%, and the hormones that should not be too high will decrease then. And so the diet is extremely important for efficacy of hormone therapies.
What other typical dietary recommendations do you give patients next to stopping alcohol and minimizing caffeine?
Well, there are 2 things. First, eat the Paleolithic type diet, the diet of our ancestors that exists since millions of years. That food is adapted for us. So that food doesn't include bread. It doesn't include sugars. It may include fruits, but whole fruits. And it includes fresh fruits and not preserved foods. So it's really fresh vegetables and fruit. Eating also fresh meat, unprocessed meat. There's more mortality with unprocessed meat. And also fish, poultry, but don't cook them at high temperature. They have to be boiled or in the oven at 85 degrees Celsius, but not higher, or you burn the food and make it toxic, carcinogen, and you get tired from it. So Paleolithic diet, and then what is very important is not to eat proteins in the evening. People eat proteins in the evening, lifelong, an upper belly that is bloated. Why? Because it takes on average 6 hours to digest meat. And when you eat at 7 o'clock and you go to bed at 11 o'clock, you still have meat digesting in your belly, and then the whole night you lie flat. So it won't go down. It's going to be a sort of fermentation. And lifelong, if you do that, you will have a bloated upper belly, which as a man is absolutely not attractive for a woman. Women look first at the belly of a man, not look at the breasts of a woman, but the belly is important. You have to have a flat belly or you're not so attractive anymore. So why not be attractive?
Sure. So then it must be a myth that in the fitness industry, you have to drink a protein shake before you go to bed to have a continuous amino acid flow to the muscles the whole night.
Very easy. You just look at their belly and you have understood what happened to their belly and how that wasn't good for the belly. So really men should try to have a flat belly. And even I do some exceptions that are not so good. So I can improve too.
Mm-hmm. I'm sure next to hormones and diet, you are recommending some supplements to patients as well, vitamins, minerals.
Yes, a lot. Half of our prescriptions are actually generally nutrients because it helps. Even for longevity, for example, they are almost as efficient as hormones to lengthen your life, at least in studies. So you don't feel the efficacy always so good, but it works well. One of the major supplements that we recommend almost all the time, because it's deficient in almost everybody, is magnesium. Magnesium protects your heart. It relaxes. When I eat a lot of fruits, I get spasmophilia. I had today spasmophilia again because I ate some fruits. So I took a lot of magnesium and it went away virtually. Mm-hmm. So magnesium, very important to feel good. You are less tired in your muscles when you have enough magnesium. And the typical sign of magnesium deficiency is afternoon fatigue. So you get rid of the afternoon fatigue with magnesium. And then we also give vitamin A, because for the skin, it's very important. And you know as a dermatologist probably even better than I do, but you get fissures on the heels when there's magnesium deficiency. And in the tongue, you get splits in the tongue. So it bursts the skin so dry that it bursts open in the mucosa too. So vitamin A is really important. And we give higher amounts of the safe form of vitamin A, retinyl palmitate, because there's a water-soluble vitamin A that is toxic, so don't take that. Mm-hmm. And then we take vitamin E, antioxidants, the vitamin D, very important, higher amounts actually that are safe, up to average 10,000 international units, 5 to 10,000 per day. And we provide also trace elements. In the vitamins, we also give coenzyme Q10 easily because it helps. It's a very strong antioxidant. We give 100 milligrams, for example. And then we go to the trace elements where we can give iron or copper and most often zinc. Many people are deficient in zinc, and that's really also good for the skin. It's anti-acne. You get purulent acne when you have zinc deficiency. So that is really, really interesting to do. Give a lot of other, we do a profile of the fatty acids, so we can give omega-6 or omega-3 polyunsaturated fatty acids or monounsaturated like olive oil and things like that. It's really, really interesting. I find this so fascinating.
Yeah, me too. I'm very into the supplements, of course. I've been taking all kinds of supplements since many years. Also, for the skin, zinc, vitamin A, but also, for fitness reasons, omega-3 and so on.
A lot by fitness, so you need to take more anyway.
Yeah, sure. But what struck me the last few years with our COVID pandemic we had here is that so few people know about all the advantages of the vitamin D, zinc, and so on for the immunity. They'd rather take all pharmacological stuff, vaccines, and so on. And if you recommend them to take vitamin D, they don't even do it. And the media is the same. Why haven't they told the people, take your vitamin D, take zinc, take quercetin, and so on, to make you less prone to infection?
Well, I can tell you a lot about it because I made a petition and there were about 60 physicians signing it, 30 naturopaths also signing it. And we proposed to all the political we have 9, imagine that. In Belgium, we have 9 ministers of health. And only one answered actually that he was open to it. So he proposed on his evidence-based committee. The evidence-based committee, there was no literature. I was full of literature. And then I said, I'm not going to help these guys. So I made some YouTube videos because I proposed basically that the state would pay 0.2 euros and everybody would get zinc and vitamin D. And we had a lot of testimonies that it saved the life or at least the health or decreased the disease of taking those supplements. So, and so basically I did YouTube videos, and what I heard, and many other people, I think some other physicians did that also, actually all the nutritional firms were very, very happy. They said, we never sold so much vitamin D and zinc. So they were very respectful for our interventions because it brought them a lot of money. They said, you don't even have enough packages to send. So the public was much more alert, at least in the French-speaking part and in the Brussels part. They really, it's not for nothing that Brussels was an anti-vaccine hold on, because they had alternatives.
Sure. Yeah, I try my best to inform patients about that as well. I recommended zinc, quercetin, vitamin A, vitamin D, of course, to ramp up the immunity against viral infections. But not a lot of people here were open to it. They'd rather take a pill or something pharmacological.
Well, the magic thing I felt is say, I take it also myself.
Yeah.
And when you say that, you already have it easier to convince. I do this also for the hormone therapies. I mention all the hormone therapies. When I give workshops, often doctors ask my program. So I put the program in front of the whole audience of all the hormones I take. So the more we testify, the better it is. But it sure is not always the person we want to convince. It's sometimes other persons who will get the information by these persons. So you're still being very successful. But you just don't see it as much because the person that you informed was just an intermediate person who gave the information to others.
Yeah, sure.
Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.